Hi, I am Linda, welcome to this video. In today's fast pace we live in, your body can have feelings of aches and pains that have become an almost worldwide experience, whether it is pains from a result of strenuous physical activity, the wearing away of the joints in the elderly, or the stresses of modern living. Finding relief from these discomforts is common. I am not a medical professional, and the information in this video is for information only. Please visit my website, where you can learn more about this terrible disease. In today's video, I will explore arthritis and its overall diagnosis. I will discuss some common types of arthritis, when to see a doctor, and why you must see a doctor early. Did you know that arthritis is not just one condition? It includes over 100 different joint diseases, including osteoarthritis, rheumatoid arthritis, psoriatic arthritis, gout, and lupus arthritis, and the list goes on. Because arthritis symptoms, such as joint pain, stiffness, swelling, and reduced mobility, can look similar to those of other conditions, it is essential to get an accurate diagnosis. So, let's examine how arthritis is diagnosed. It starts with a detailed medical history and a physical examination. Your doctor may also take you for lab tests, such as blood tests that check for inflammation and other markers. Also, imaging tests, like X-rays or MRIs, help determine the type and severity of the arthritis. Understanding the diagnosis process can help you take charge of your joint health. If you are experiencing persistent joint pain, you should not wait. Talk to your doctor today. Please hit the like button and subscribe for more videos on arthritis awareness and management. Arthritis is a term for various diseases that cause joint pain, inflammation, and stiffness, and in some cases such as rheumatoid arthritis, it can cause deformities, like misshapen fingers, or reduced mobility. It also attacks your immune system, and it can even attack your nervous system, leading to serious complications. This damage happens over time through the body's immune system, or wear and tear as the joint structures break down. The good news is that early treatment and lifestyle changes can help slow the progression of arthritis and protect joints. When you go to the doctor, they will examine you through 4 stages to determine which type of arthritis you have and how far it has developed. The first step is a detailed medical history. Your doctor will ask key questions to understand your symptoms and risk factors. 1. Symptoms. Do you have joint pain, stiffness, swelling, redness, warmth, or reduced mobility? 2. Duration and pattern. Is the pain worse in the morning? Does it improve with movement? 3. Family history. Do any of your relatives have arthritis or autoimmune diseases? 4. Past injuries. Have you had previous joint damage? 5. Lifestyle factors. Your doctor will ask about diet, physical activity, occupation, and stress levels. 6. Other symptoms. Fatigue, fever, rashes, eye inflammation, or weight loss may indicate autoimmune arthritis. Step 2. Your doctor will perform a physical exam to check for visible signs of arthritis. Joint swelling, redness, and warmth signs of inflammation. Pain with movement, this may indicate stiffness or cartilage damage. Joint deformity. Common in advanced arthritis. Muscle strength and reflexes helps assess nerve involvement. Nail and skin changes could suggest psoriatic arthritis or lupus. Spinal tenderness may indicate ankylosing spondylitis. The third step would be to have your doctor order blood tests to distinguish between inflammatory and non-inflammatory arthritis. Some blood tests could include rheumatoid factor positive in most rheumatoid arthritis cases. Anticyclic citrullinated peptide antibody, this is also more specific for rheumatoid arthritis. C-reactive protein erythrocyte sedimentation rate measures inflammation. An antinuclear antibody test detects lupus arthritis and autoimmune diseases. HLA-B27, which is a protein found on white blood cells linked to ankylosing spondylitis. Serum uric acid elevated in gout. Lastly, your doctor may send you for imaging tests to help assess joint damage and inflammation. X-rays detect bone spurs, cartilage loss, and joint space narrowing. MRI identifies soft tissue damage, early cartilage loss, and synovial inflammation. Ultrasound reveals joint fluid buildup and inflammation. CT scan useful for detecting complex joint damage in the spine and hips. Before we dive into the diagnosis of different types of arthritis, I would appreciate it if you clicked the subscribe button and the bell icon. This way, you will stay updated on more videos about arthritis and related topics. Arthritis is a broad term that covers various joint diseases. Each type requires a different approach to diagnosis. Let us examine each type. 1. Osteoarthritis, OA, wear and tear of the joints. Osteoarthritis is the most common type, caused by cartilage breakdown over time. You may get symptoms, including pain that worsens with activity and improves with rest. The common joints that can be affected are the knees, hips, hands, and spine. There are no systemic symptoms like fever or fatigue. The diagnosis is an X-ray that reveals cartilage loss, bone spurs, and joint space narrowing, or an MRI scan normally used in early or unclear cases to detect cartilage damage. Lab tests. Although there are no specific blood tests for this disease, joint fluid analysis may rule out other conditions like gout or infection. 2. Rheumatoid arthritis, RA, autoimmune inflammatory arthritis. Rheumatoid arthritis is an autoimmune disease in which the immune system attacks the joints, causing inflammation and damage. The joints affected can become symmetrical, which means if you have it in your right wrist, you will develop it in your left wrist. Other symptoms include joint pain in both hands and knees, as well as morning stiffness lasting over an hour, swelling, redness, and warmth in joints. Other symptoms can be fatigue, fever, and unexplained weight loss. Lab tests could be many, including many types of blood tests. They can include rheumatoid factor, RF positive in most cases. Anticyclic citrullonated peptide antibody, highly specific for rheumatoid arthritis. Other blood tests, like C-reactive protein and erythrocyte sedimentation rate, inflammation markers elevated in active disease. A complete blood count may show anemia. Imaging tests are also done by X-ray or MRI to detect joint erosion, narrowing, and deformities. 3. Psoriatic arthritis, PSA, linked to psoriasis. Psoriatic arthritis is a form of inflammatory arthritis that often affects people with psoriasis. The medical history and physical examination can include examining a patient's fingers and nails, often linked to psoriasis, but joint symptoms can appear first. Dactylitis, sausage-like swelling, in fingers or toes. Nail changes like pitting or ridges. Joint pain and stiffness affect fingers, toes, spine, and the sacroiliac joints. There are no specific lab tests for psoriatic arthritis, but you may have imaging tests such as X-rays, which can reveal pencil-in cup deformities in your fingers. MRI and ultrasound detect inflammation in tendons, enthesitis. 4. Gout caused by uric acid crystals. Gout is a form of arthritis caused by excess uric acid in the bloodstream, leading to painful joint inflammation. You may also feel sudden, intense joint pain, often in the big toe, podagra, redness, swelling, and warmth around the affected joint. Lab tests for gout include serum uric acid levels, which are often elevated, but not always diagnostic, and joint fluid analysis confirms gout by detecting uric acid crystals under a microscope. Imaging tests can involve X-rays or ultrasounds to detect tophi and joint damage in chronic gout. 5. Ankylosing spondylitis, AS, arthritis of the spine. Ankylosing spondylitis is a type of arthritis that primarily affects the spine and sacroiliac joints. Medical history and physical exam You may develop chronic back pain starting before age 40. Morning stiffness improves with movement. Pain in the lower back, hips, and sacroiliac joints. Lab tests can include a gene test. It is positive in many cases, but not definitive. Imaging tests. X-ray detects sacroiliac joint inflammation. MRI more sensitive for early stage of ankylosing spondylitis before X-ray changes appear. 6. Lupus arthritis, autoimmune arthritis from lupus, SLE. Lupus arthritis is an autoimmune arthritis that occurs in people with systemic lupus erythematosus. Medical history and physical exam, joint pain, with rash like a butterfly rash on the face, fatigue and fever. Also, joint pain without severe erosion, unlike rheumatoid arthritis. Lab tests, antinuclear antibody that is almost always positive. Anti-DNA, and anti-Smith antibodies highly specific for lupus. Imaging tests could include X-ray and MRI, show inflammation, but usually no joint erosion. 7. Reactive arthritis, post-infection arthritis. Reactive arthritis develops after an infection, often affecting the joints, eyes, and urinary tract. Medical history and physical exam, joint pain after a recent infection, gastrointestinal, or sexually transmitted infection. The classic triad is arthritis, conjunctivitis, red eyes, and urethritis, painful urination. Lab tests. Some blood tests, such as the HLA-B27 gene test, which can be positive in some cases, may be drawn. Tests for past infections, e.g. chlamydia, salmonella. Imaging tests, X-ray, may show changes similar to ankylosing spondylitis. 8. Septic arthritis, joint infection, medical emergency. Septic arthritis is a dangerous joint infection that requires urgent medical care. Medical history and physical exam, sudden, severe joint pain, fever, chills. The affected joint is hot, swollen, and extremely painful. Lab tests and blood cultures detect bacterial infection. Joint fluid analysis confirms infection by detecting bacteria, white blood cells, and pus. Imaging tests X-ray, MRI, or ultrasound used to detect joint damage. Arthritis diagnosis varies depending on the type. If you're experiencing joint pain, consult your doctor for proper evaluation. Arthritis affects millions of people, but early and accurate diagnosis is key to preventing long-term joint damage and improving quality of life. Since different types of arthritis require different treatments, a comprehensive evaluation is essential. This includes a symptom assessment, which identifies joint pain, stiffness, and swelling. Blood tests detecting inflammation and autoimmune markers. Imaging tests X-rays, MRIs, and ultrasounds to assess joint damage. Joint fluid analysis checking for infection, uric acid crystals, or inflammation. If you experience persistent joint pain, swelling, or stiffness, consulting a healthcare professional can lead to early intervention and effective management. If you have the following, you need to see your healthcare professional. They include joint pain lasting more than 6 weeks. Morning stiffness lasting over an hour. Red, swollen, or warm joints. Unexplained fatigue or fever. With the right diagnosis and treatment, individuals with arthritis can maintain mobility, reduce pain, and continue leading an active and fulfilling life. Stay active. Follow treatment plans, and prioritize joint health. Don't ignore persistent joint pain. Seek medical advice early and take control of your joint health. Thanks for listening to my video. If you found this video helpful, please subscribe to my channel and click the bell icon to stay updated. You can also click on the next video to learn about foods to eat and avoid. I am not a medical professional, and this video is for information only. If you have concerns about your condition, be sure to consult your healthcare professional. I would like to know if you have any questions about this video. if there is anything I have not covered, or if you found it helpful. Just leave a comment below, and I will do my best to respond. I hope you found this video useful. Good luck.